Hello and welcome to another live broadcast with MedStar Health. My name is Sarah Ridenauer and I'm joined today by our experts from MedStar Health GI Connected Care. As Thanksgiving approaches, we prepare for family gatherings and large festive meals. Many of us overindulge and it can lead to heartburn, bloating, and acid reflux. If these symptoms occur on a regular basis, despite usual eating habits, you may have GERD, also known as gastroesophageal reflux disease. To learn more about GERD, its risk factors, and treatment, we invite you to watch this broadcast, share it with your friends, and if you have any questions for our experts, you can leave those in the comments below. So, before we get started, let's meet our experts from the GI Connected Care for today's show. So, I'm just going to ask each of you to introduce yourself. I'll start with you, Dally.
Thanks, Sarah. Hello, everyone. My name is Dali Alex, and I'm a board-certified family nurse practitioner. I have been in practice for about 6 years. I joined MedStar Health initially in 2021 and part of the GI team since last year. I do see patients with general gastrointestinal conditions and special interest in colon cancer screening. Glad to be here.
Great. Thank you so much for coming. Brianna?
Hi, everyone. Thank you guys for having me. My name is Brianna Bradley. I joined the GI team as well last year in MedStar. I have been practicing for almost 5 years, have a little experience in general surgery as well, thoracic surgery, and some esophageal conditions. So thank you so much for having me.
Yeah, thank you. And Ramuna?
Hi, everyone. My name is Mamuna. I'm a nurse practitioner. I've been a part of the MedStar system for now 20 years, 10 years as a nurse, and then another 10 years as an NP. I'm new to the GI team, but it's a team that I am learning and enjoying the experience. So that's my story.
Awesome. Well, thank you all again for joining us today and answering our questions. So let's get started. First, let's talk a little bit about the GI connected care before we dig into the specifics of acid reflux. So, Dally, could you please tell us a little bit about the GI connected care?
Sure. So GI Connected Care is a telehealth option or virtual health options which provide you a convenient, easy access to a GI specialist to address your GI health concerns.
Great. And what are some of the most common GI health concerns that patients would call about?
So we do see general gastrointestinal conditions, but most common to say is abdominal pain, abdominal bloating, changes in bowel habits like diarrhea or constipations, rectal bleeding, dark stools, hemorrhoids, and colon cancer screening. It could be pre-screening for colonoscopy or a Cologuard home test kit.
Okay. And are there any other conditions that maybe aren't as common but could still be, something that people call about?
Sure. Forgot to mention GERD is very common condition we treat, and nausea, vomiting, difficulty with swallowing or painful swallowing, belching, burping, IBS, and abnormal liver function testings, anemia, and any GI tract abnormal imaging for further workup often referred to us.
Okay, so it sounds like a lot. And now, Brianna, what are some of the benefits of the GI connected care?
We get you in fast.
Yes.
It's like an express. I'm very, very happy because we know that there is always a gap trying to get specialty care. And so gastroenterology, sometimes you can't get in to see a provider, whether that's a doctor or a nurse practitioner, for 3 or 4 months. We have taken that down and have been able to get patients in about 24 to 72 hours. And I think patients are excited about that. We've seen almost 8,000 patients. So I think we're doing a good job at that.
Yeah, that's awesome. That's the quicker the better. It's always good to be able to get seen quickly. And
Absolutely.
so how does somebody make an appointment?
So typically, our patients come referred by their primary care doctors. Not everybody needs to have a referral. Some patients' insurance, like HMO, do need a referral, but they can also call our office to make an appointment. That telephone number is 202-912-1300. And I think it's going to be shared on the flyer so you guys can write it down, but give us a call.
Perfect. Yes, well, we'll put that number in our comments. So thank you all for giving us a glimpse into how GI connected care can help patients who need easy access to gastroenterology experts for conditions like we said, such as acid reflux, as well as other upper and lower GI issues. So before we get into talking more about acid reflux and GERD, I just want to say if you're just now joining us, welcome. Today we're talking with our GI connected care experts about recognizing, preventing, and managing GERD. If you have any questions at any point, please add them in the comments and we will try and get to those throughout our broadcast. So let's continue with our discussion on the best ways to avoid and treat heartburn during the holiday season. So are acid reflux, GERD, and heartburn, are they the same conditions, or just similar? If so, what are the symptoms? I'll ask you, Brianna.
I like to break this up into three things because they are interconnected, but they're not a disease per se. So heartburn is a symptom, right? Heartburn can feel like burning of the chest, the esophagus, maybe like the upper abdominal, which we call the epigastric region. This can be caused by just stomach acid coming up into the esophagus, and sometimes you'll have patients say, "Oh my, my chest burns, my throat burns," right? Acid reflux is an event, right? So when we think about acid coming back up into the stomach, etc., you might have a sour taste in your mouth. We have patients who come and say, "Oh, I've been having a chronic cough and I don't know why. Like I'm not sick, I don't have allergies," those kinds of things. So we definitely like to look at those. Also, just chest tightness. We have a lot of patients who come through the emergency department and say, "Oh, I have chest pain. I think I'm having a heart attack." Really, it might just be acid reflux, just giving you that pain. GERD is a little bit more chronic, right? So this is the disease process. So this is chronic acid reflux that has happened maybe more than twice a week. Maybe you're on medications for that. Maybe you have some damage to the esophagus because of the acid reflux. So that's kind of how I like to break it down.
Got it. Okay, yeah, that was a good breakdown. I know that I kind of sometimes will use the terms interchangeably, and that doesn't seem to be correct. So that's good to know. That was a good way
It
to
kind
break
of
it down.
is. Yeah, it kind of is, but it's, categories or
Yes.
levels to that.
Yes. Yeah. And so, how would GERD be diagnosed?
So typically when we see patients with acid reflux or GERD, we try to go and let the patient kind of tell us what they've been experiencing. So we look at symptoms, right? How long has this been going on? How often are we experiencing these symptoms? What symptoms do you have? Is it a cough? Is it burning of the throat? Is it, I feel, patients say I have a frog in my throat. So sometimes they have trouble swallowing, maybe have nausea, vomiting. And so we kind of go through the interview with the patient just to say, what are you dealing with right now, right? And then we kind of go through what's causing this. A lot of times patients have food triggers, right? So it could be I ate McDonald's, or I like pepperoni pizza, or I drink caffeine every day. And so we try to go through those things so that we can find an origin, what's causing this. We can also, try to do like some medications to help with that, and then kind of go from there. I think chronically, when we think about assessment, we might do other things, what is called an upper endoscopy, or what doctors might call an EGD, to kind of look at the esophagus to kind of see what's going on. Is there inflammation there? Is it something that we're missing? Other tests might be like an esophageal manometry or pH monitoring to see how much acid is flowing up into the esophagus. So those are some diagnostic things we typically do.
Okay, thank you for going through that. And so, what are some of the risk factors for GERD? I mean, I know, people talk about poor diet, like Brianna just mentioned, with certain foods can be triggers. Is it hereditary? Can it be caused by anything else? Can you just go over some of those risk
Sure,
factors?
sure. So, with Thanksgiving coming up, high fatty meals are a contributing factor. Smoking cigarettes, caffeine intake, obesity is a contributing factor as well. Drinking a lot of carbonated drinks can also be a contributing factor. We always mention spicy meals,
Mhm.
onions, garlic, eating about 30 minutes before bedtime. You're not letting your food to digest. All those factors can contribute. There are some hereditary components, but the where is it coming from hasn't been really truly assessed clearly. But far as lifestyle modification and dietary modification, I think as providers, we try to always emphasize that because although we can treat, it has to be a partnership with the patient and making sure that they have to also do their part in order to alleviate any of these symptoms that may occur.
Okay. Yeah, I've definitely heard the spicy foods and the carbonated drinks. I love my spicy food and I love my Dr. Pepper, and they definitely can be triggers for me sometimes. So speaking of, the treatment and everything, what can happen if GERD isn't treated?
Long-term effects. Long-term effects can actually change the esophageal lining. So it can cause like an esophagitis, which is an inflammation of the esophagus. It could cause the actual esophagus to narrow. So we use the term esophageal stricture. And then long-term effects have been associated with like Barrett's esophagus, which is a change in the esophageal lining that has like precancerous cells. So, yes, overall, we like to address it and make sure everybody is a part of the team when it comes to making sure your GERD symptoms are alleviated because they can lead to issues that can be long-standing.
Yeah, that's good to know because I feel like sometimes people can put off symptoms like that and it disrupts their life, but maybe not to the point where they're like, oh, I got to do something about it. But clearly then it could turn into something worse and we don't want that to happen. So Dally, what are some of the treatment options for GERD?
Thanks, Sarah. So GERD is absolutely treatable condition. Just to say that the treatment approach is more like a multidisciplinary approach, just like Memuna was saying, right? Lifestyle modifications and dietary changes are very important elements, right? So, for example, lifestyle changes like patients with excessive alcohol intake or chronic smoking, we do counsel them to minimize or cut back the use or intake. And if they are interested in cessation program, we could definitely care coordinate with the primary care team and make sure they receive the help required. And obesity. So these are like modifiable risk factors. So there are a lot of medications available now for weight loss, and certain patients do qualify for surgery. For example, BMI over 35, they are qualifiable for bariatric procedure. So we could provide referral to a specialist. Then dietary changes. So for that, we advise, say the patient just to keep a food diary to identify your own personal triggers because everybody's triggers might be different, right? So caffeine, carbonated beverages, or spicy meals, fatty meals. And so identifying the triggers and the pattern and minimizing or eliminating those. And changes in the dietary habits, like having big 2 to 3 meals to 5 to 6 small meals spread out through the day, staying active, and of course dinner at least 3 hours before bedtime, elevating the head at night. So these all measures can help. Then, of course, there are treatment like medications available. So patients with like rare episodes, they often rely on over-the-counter antacids. So this help to neutralize the acid. But for patients with recurrence, we can have prescription medications. We do prescribe. Some of them includes PPIs, like proton pump inhibitors, H2 blockers, and there are new medication available called PCABs, like potassium competitive acid blockers, which are more reserved for like first line medications are not effective. They are having persistent symptoms. These medications are another option for them.
Okay.
And there are surgical options as well for patients if first line medications are not effective.
Okay. Yeah, that was gonna be my next question is surgery an option? So I guess like at what point would the surgery become part of the conversation as the way that this is treated and can you talk a little bit about those surgery options?
Sure. So the patients who are like, they have incorporated all these modifications, like lifestyle modification, dietary changes, they worked on the weight loss, but still the symptoms are refractory, then definitely surgery can be an option for them. And I like to state specifically like hiatal hernia, right? So this is a condition where part of the stomach is sliding through the hiatus. So the diaphragm is the muscle which separates the thoracic cavity. And sometimes the stomach slides through the hiatus and causing the reflux, right? Condense to reflect back to the esophagus. So those patients are qualified for surgical options. So we have specialists like thoracic surgeons who perform the procedure. There are couple of surgeries, but the most common is Nissen fundoplication, right? So they kind of use the upper part of the stomach to wrap around the esophagus to reinforce the sphincter to prevent the reflux. It's very effective. And there is another procedure which is less invasive. We call TIF, TIF, transoral incisionless fundoplications, which is performed through the endoscopy. Just like Brianna mentioned, like it's a diagnostic procedure, but this can be also done through the endoscopy. So it's like a small scope inserted, and we can do a modified fundoplication for this, and it's very effective. And another one is not more common, but just to mentioning it, it's called LINX. It's an implantable metallic ring placed around the esophagus to prevent it from opening. There can be some side effects, so it's not most commonly used. And the other condition, like I stated earlier, like, patients with elevated BMI, weight reduction can significantly help them to prevent the reflux. So they are eligible for bariatric surgeries.
Okay. Interesting. Thank you for explaining that. And Mamuna Dali mentioned a little bit about over the counter, taking those. How long should someone wait though if they have symptoms and those over the counter antacids aren't working? How long should they wait to go get checked out by a
Before
doctor?
being seen, yeah.
Yeah.
Ideally, give yourself about 2 weeks. But when I say 2 weeks, I want the patient to also be mindful of the dietary and lifestyle modifications, those triggers. Um, 2 weeks gives the antacids enough time to see if they will suppress it. But if your symptoms are still recurring within that 2 weeks, I would recommend see a provider.
Okay. Good to know. And like we said, the holiday season is coming up. Thanksgiving's right around the corner, and then Christmas, lots of big holiday meal type days coming soon. So, what suggestions do each of you have for curbing GERD symptoms this holiday season? I can start with
Um,
you, Nina.
I would say food is also so it's what we celebrate.
Mhm.
I would say be mindful, but also enjoy the family component and the friend component of Thanksgiving. If you are going to eat, take it easy. Like you have all day. You may have the next day, but you don't
Yeah.
have to indulge in everything all at once, because no one wants to be in pain afterwards, right? So I would say more so focus on the family time, focus on that component of being together, and then enjoy food, but enjoy it at a steady pace and not at a race.
Yeah, that's something I definitely need to remember. I'm sometimes eating it like it's going to be taken from me, and that's not the case. Brianna, did you have something to add?
I was gonna say the same. Just pace yourself, you
Yeah.
get you some appetizers first and then
Mhm.
work your way up to dinner. And I'm never gonna tell anybody not to eat because I know I'm getting seconds. I'm gonna get dessert. Maybe after your first plate, take a walk if it's nice outside, get your body moving so you can, start to digest before you go back in for your next plate, or maybe make your next plate a little smaller,
Yeah.
a full plate, and then have you some dessert and move around a little bit more. Those kids, they like to run around. I have a toddler, so just run around with the kids.
Yeah. That's great. Yeah, I think Dally, you had mentioned, like you said, eating smaller portions. So that's definitely something that is, at least for me, not common on Thanksgiving. I load my plate up, but yeah,
Mhm.
taking time to, make it smaller portions and, like you said, take walks, whatever. Dally, did you have anything else to add?
Yeah, just to to support what my colleague said, but probably it's best to schedule an early dinner because
Mm,
eating late is not the best for
right.
patients, like if they are suffering from GERD. And other thing is a lot of substitute water for sodas because
Mm.
caffeine, carbonated beverages are notorious to trigger the symptoms. So just to avoid that. And just in support of everyone said, so small, frequent meals, everything in moderation, minimize the alcohol use.
Yes, yeah, those are all great pieces of advice for, right before Thanksgiving and like I said, holiday season coming up. We do have a question from our audience. Debbie asks, are there any natural remedies that you can try for heartburn before taking over-the-counter meds? Is peppermint good to settle down heartburn?
Peppermint is good for the gas aspect of that.
Okay.
If you've ever had surgery or something like that, and they tell you about like built up or trapped gas, they might say like peppermint or like peppermint pills, etc. So if you have the gas component or the indigestion component of the acid reflux, I think peppermint is actually good. Also, herbal teas like green tea can also be a good thing as well.
Okay, yeah, I was gonna ask. I've heard mixture of both peppermint tea. I've heard to drink that sometimes. Okay, thank you. And so before we wrap up, we'd love to hear a final takeaway from each of you, the message you'd like our viewers to leave with after watching this broadcast. Brianna, I'll start with you.
I would say enjoy your holidays. We know, family, a lot of events are coming up, but spend as much time with your loved ones as you can. And if you're having symptoms that have been long standing, definitely do the research, but talk to your doctor. Come and see us. We're here to help. We want to educate you guys and make sure that you are you know, educated and leaving with the knowledge that you need to distinguish what is, maybe minimal and what might be chronic. So definitely spend time with your family, but also, come and see us if you have questions. We're absolutely here to help.
Yes, definitely. Dally?
Yeah, so I like to wish those who are listening a happy and peaceful Thanksgiving. Just to echo what my colleague said, if you're having symptoms which are not going away, specifically any pain or difficulty with swallowing, constant burning, we are here to help. We are open and working. So make a call if your insurance do need a referral. Talk to your primary care doctor, and we can help you.
Great, thank you. And Ramuna?
I think I'm a piggyback with what my colleagues have said as well. We are here to help. We take value in what we do. We are patient focused. This is a collaborative experience when you reach out to GI Connected Care. I'm wishing everyone a happy holidays. Enjoy the time with your family. Enjoy food, but be mindful. And if you are having pain, come in. We're here.
Awesome. Well, those are great messages to leave on. Thank you again for sharing your expertise and taking your time to be here with us today and answer our questions. And thank you to everyone watching. We hope today's conversation helps you enjoy your holiday meals with more comfort and confidence. To learn more about GI symptoms and the gastroenterology services we offer at MedStar Health, you can visit medstarhealth.org/gastroenterology. We'll post that link in the comments below. And to schedule a telehealth appointment through GI Connected Care, please call 202-912-1300, which I believe we posted before, but we'll post again in the comments as well. Thank you again for joining us. We hope you enjoy a healthy, heartburn-free holiday season. We'll
All
see you
right,
next
thank
time.
you.
Thank you.
Thank you.